Module 2 of the lymph system is all about the immune function. Prepare to be amazed. The objectives of this module include explaining the 3 lines of defense. The first part of this module will discuss non-specific immunity, and then you should be able to describe the first and second line of defenses after the first part of this presentation, and then we'll talk about the specific immune response. The first 2 lines of defense will try to protect you from any possible pathogen. It's not specific to any particular virus or bacteria, for example, but any particular pathogen. These include physical and chemical barriers, as well as the internal defenses like having a fever. The third line defense system is very specific and is launched against just one particular pathogen at a time. Let's make sure we're all on the same page with some basic definitions. A pathogen is any disease-causing agent. It's usually bacteria, viruses, fungus, parasite, but it can be anything that causes a deviation of health. Contact is when the pathogen gets in or on you. Okay, so contact has to occur in order to get to the next step, which is infection. Infection is the time between that microbe or that bug getting in or on you and you having noticeable signs and symptoms of disease. Generally, during an infection, you don't know that you have been infected or that you're carrying around this particular pathogen. Sometimes it's called the incubation period. Disease is when you had noticeable signs or symptoms of a change in health. A sign is something you can see or measure, like a fever or a change in blood pressure or redness, whereas a symptom is something a patient says or complains about. I'm hot, or I have a headache, or my back hurts, or I feel like my insides are on fire. Okay, these 2 things together, the signs and symptoms, usually help a doctor or a healthcare professional figure out what is wrong. So even though headaches or pain are not able to be measured, like a fever or a cough can be heard, they're often very important to help with a diagnosis. First line defenses are barriers. They physically try to get in the way of contact or try to prevent the bug from sticking once it is contacting or touching you. One of the best defenses this way is your skin. It's dead for one thing, and it's hard to hurt something that's already dead. The mix of keratin, oils, sweat, and the dead layer of cells on your skin is a great defense barrier against almost all pathogens, unless, of course, you poke a hole in your skin. The epithelial cells which line your tubes and ducts are also a good barrier. Some have cilia, some produce mucus, some release a chemical called lysozyme, which is toxic to some bacteria. And then, of course, there's the acid in your stomach, which is one of the best defenses you have considering how much microbes you actually eat. All of these things trap or kill pathogens. Again, stomach acid is probably one of the best. Last, some reflexes, while uncomfortable and don't smell all that good, are a great way to get rid of lots of pathogens all at once. Diarrhea may stink, but what a great way to get rid of a lot of pathogens all at one time, and now they're not inside and able to get across that barrier and into your blood and cause sepsis. The second line defense systems all protect against the pathogen, again not any particular pathogen, that has already gotten into the body. Okay, there are several ways the body does this, and it all starts with inflammation. Okay, so we're going to talk about each one of these 5 things, in particular how inflammation triggers each one of them. So triggers for inflammation include impact, abrasion, distortion, different chemicals or pathogens. Even an extreme change in temperature can induce inflammation. And immediately, once you have that trigger there, vasodilation of the nearby blood vessels occur. Not of the one that got poked, if one did, because you don't want to vasodilate a blood vessel that's already got a hole in it. Even more blood loss would occur. But nearby blood vessels will vasodilate. This will bring in more white blood cells and more blood. Because there's more blood, it will be warmer. It will also be redder, so you'll see redness in that area. The more blood cells that come include white blood cells, which will increase phagocytosis. the chemicals that are released when you damage an area, like in this picture where the splinter has damaged it, will cause neutrophils to rush to the site of infection, as well as macrophages and mast cells that are already within the tissue. So the immune system is going to respond very quickly to this. They themselves will release even more chemicals, cytokines, in that area, bringing in more blood cells, increasing phagocytosis and causing vasodilation, more blood, and also diapetesis, the ability of white blood cells to move out of the blood vessel and into the tissue. There's a great little animation here if you want to check this out in more detail. Okay, so phagocytosis, remember, is engulfing, or when a white blood cell kind of wraps itself around a toxin or a bacteria, sucks it in, and of course will destroy it with the involvement of lots of its lysozymes. Remember that lysozymes are the garbage disposals of the cell. Anyway, these white blood cells are moving out of the blood capillary here, this neutrophil, and eating up the bacteria. Phagocytosis is one of the best things about inflammation that occurs. A good example here, a good picture of this white blood cell moving out of a blood vessel, that's called diapetesis. And only white blood cells can do that. It's kind of amazing. Natural killer cells are nonspecific warriors which run around and watch for cells that have become corrupted. For example, maybe they've turned into cancer cells, or they've been infected by a virus. So it's kind of like our surveillance policemen that are running around. They're not necessarily specific for one type of cancer or one type of virus, but are looking for cells that have become corrupted or gone to the dark side. This is a great YouTube. I'll show it in class. You can click on it if you're interested, but it's a great little show about what natural killer cells can do. I used the word cytokine a slide or two ago, and these are chemicals released by white blood cells that help our immune system communicate with each other and tell it what to do. And most of these act very locally when tissue is damaged and cytokines are released. That induces phagocytosis and diapetesis and vasodilation. And so these are the chemicals that are causing those actions. They're also the chemicals that can cause side effects for us. Vasodilation and increased fluid in that area causes swelling, and swelling pushes on pain receptors, which causes us pain. But then at least we know where to go look for the splinter and dig it out. Histamine, for example, is a cytokine that causes lots of allergic reaction type symptoms, runny nose and difficulty breathing. Interleukin 8, I think, is the one that induces a fever, for example, which we don't particularly like the feeling of. So we often take medicines to block cytokine release, even though in our bodies they're helping the immune system kind of get turned on and revved up and work. The complement gets its name from the fact that this set of proteins helps the immune system work better. They particularly help antibodies work better, which we're going to talk about antibodies in a little bit here. But it's a system of proteins that can be activated directly by pathogens or by a pathogen-bound antibody. It leads to a cascade-like set of reactions, and you can see all these little reactions occurring, and this is enough to make your eyeballs roll back in your head when you start reading about the complement system. So just remember, it's a set of proteins that help your immune system work better, particularly how to make antibodies work better. Another thing that is part of the second line immune response is having a fever. Any protein or any substance that induces a fever is referred to as a pyrogen. Think about a pyromaniac likes to start fires. Okay? These pyrogens, or whatever they might be, causes a release of a cytokine that goes to your hypothalamus and says, crank up the temperature, dude, we need to fry some bugs. Okay, so the hypothalamus keeps the temperature around 98.6, but when a pyrogen is around, it might crank that up to 100 or 101, for example. There are 3 benefits to having a fever directly. One of them is makes your metabolism and heart rate speed up, which increases blood flow, which means more white blood cells to the site of infection. Number 2, it slows down replication of of most pathogens. Bacteria and viruses really don't like 99 or 100 degrees. So having a little bit higher temperature slows their ability to replicate. Another thing that slows their ability to replicate is taking away their iron, and that's the third benefit to a fever. It takes away it lowers our blood iron level by making your liver store it. So it sequesters our iron. This, of course, lowers our ability to make red blood cells, which makes us tired, because if we don't have enough red blood cells, we can't carry enough oxygen. So sometimes the side effect of a fever is being very tired, and that's kind of a bummer for us, but it's awesome for the bugs. It's really hard for them to replicate without iron. There's a good YouTube here about non-specific immunity. You can check this out. I highly recommend it. I will show it in class. It's a musical rap, so it's kind of cool. So we've talked about non-specific immunity. We're now going to focus on what happens when you want to really kill off the bug. You got to have the specific immune response to do that. And we're going to compare the two different types of the specific immune response, cell-mediated and antibody-mediated immunity. And you should be able to define immunoglobulin, antigen, antibody, and those types of molecules after you have listened to this second part of this module. So the specific immune system fights off specific pathogens. It now does matter whether it's salmonella or the measles virus or the chickenpox virus, because the specific immune system has cells that, or has a response for each one of these, and it's required. So if you get more than one disease at one time, if you get chickenpox and measles, for example, you'd have to have a specific response first to the chickenpox virus and then a second specific immune response to the measles virus. Anyway, it requires the pathogen to have contacted and infected you, so it's inside. It requires the recognition of specific antigens, which we're going to talk about what antigens are. And it requires the use of B and T lymphocytes, the smallest of those white blood cells. So, antigens. Antigen is any molecule which triggers an immune response. Almost always, antigens are proteins. Okay? There are examples of carbs and fats, or the combination of those, that are antigenic, but almost always antigens are proteins. Because proteins have particular shapes, remember they fold up because of hydrogen bonds, the immune system recognizes each protein separately. Each one has a different shape, and therefore the response is different for each one, which is what makes this part of the immune system specific. The most important thing the immune system must do is recognize the difference between the proteins you make, the self proteins, and the foreign ones, the ones that the pathogens make. If it can't recognize the difference, it could attack the wrong thing, and you don't want your immune system to attack you. Those are known as autoimmune diseases, and they're generally pretty bad for us. So your immune system has been taught to recognize the proteins you make, referred to as self-antigens, so it knows not to attack those. Okay? And so on your red blood cells, you have little name tags, or little antigens, that tell the immune system, hey, this is me, don't attack me. These self-antigens on the red blood cells are known as the A, B, and Rh factor. And we're going to talk about blood typing and those in lab. On all the other cells, on the nucleated cells, you have little name tags referred to as MHCs. This stands for major histocompatibility complex proteins, but basically they're a name tag that says, hi, my name is, in my case, Michelle. And they're on all your cells. This is what they would have to match up if they wanted to give you an organ, for example. So if I needed a kidney, the MHC on that kidney better match my MHC, or my immune system is going to see that new kidney as foreign and attack it. Any protein that you don't make would be foreign to you. Okay? And of course all bacterial proteins and viral proteins are going to of course be foreign, and hopefully your immune system will see that and say, oh, you're not me, I'm going to attack and destroy you. The cells that recognize these antigens are your lymphocytes. You have both T lymphocytes and B lymphocytes. You also have a set of lymphocytes known as the natural killer cells. And we talked briefly about those a couple of slides ago because natural killer cells are not specific to any particular antigen. Anyway, the T lymphocytes, the most common one, are the ones that are going to be doing the killing, and hopefully you'll understand that after we go through the specific immune response, are the cytotoxic or the T killer cells. So those are the killing ones. T helper cells are involved in the activation process of both T and B cell mediated immunity. Suppressor T cells keep your immune system from overreacting. And memory cells are what's left over after you have survived the chickenpox or the measles or whatever, and will remember that disease, and that's why you generally don't get the same disease twice. B cells, B lymphocytes, come in two varieties: plasma cells, which are the ones that are going to make antibodies, and B memory cells, which are again what's left over after a specific immune response and helps you not get that same disease again. So if you are blood type B positive, that means your blood cells have the B antigen and the Rh antigen on its surface. But if you got A positive blood by mistake, that A is going to be foreign to you and you will launch an immune response, usually so quickly and so violently that it can kill you because it causes blood clotting. Okay, so basically what happens during an immune response is you are exposed to a pathogen and the first and second line defense systems didn't wipe it out. So now it's in you and you got to do something about it because it's going to cause some problems. So hopefully some of them are engulfed by macrophages and destroyed, but just before complete destruction, the antigens from that pathogen are placed in the membrane of that macrophage and shown to the rest of the immune system. They're presented, and they literally move around in the blood and in the lymph and bump into T helper cells that hopefully one of which will have a receptor that matches the shape of that antigen. And I'll show you a picture of this in a second, but it's amazing that it works because it seems like it happens on luck. What are the odds that the one B cell that you have that has a receptor that matches that particular antigen bumps into it? Because that's the cool thing about the immune system. You have thousands of B cells and thousands of T lymphocytes, and each one has a different receptor shape on it. It recognizes a different antigen. Anyway, once that recognition happens, that T helper cell says, oh look, I found the right one, and activates B and T cell mediated immunity. The T cells will become T killer cells and B cells will become plasma cells that make antibodies, and between the two you're going to wipe the pathogen out. So let's look at these steps. Number one, a pathogen is engulfed, and there's this little dude with the eyeballs here, by a macrophage, okay, a white blood cell. And the antigens that were on the surface of the pathogen, the red, the yellow, and the blue balls, are placed in on the surface of the macrophage in the MHCs. Remember, the MHCs are your self-name tags, but they also have a job. They present the antigens. Okay, here's another one. The antigen is presented on the surface of a cell. And they run around and they wait for a helper cell, which is a CD4 cell in this picture, to have a receptor, the red and the blue thing, that matches the antigen, which is green, that's embedded in the MHC of that antigen presenting cell. Excuse me. That antigen presenting cell used to be a macrophage, but now that it has an antigen in the MHC, it's referred to as an antigen presenting cell. So you got to wait for this recognition to occur. Okay, here's another example. Here's the macrophage. It has engulfed a bacteria. The antigens from that bacteria are presented on the surface. That T helper cell with the matching receptor binds, and it starts to talk back and forth. And there's some interaction, and that's not completely understood, but there are chemicals, cytokines, released to say, okay, we know that this is the bad antigen, but this is not the bad guy. The macrophage is just the presenter, so the macrophage is probably screaming at this point and saying, don't kill me, I'm just the messenger. This is the bad antigen. But you need to activate the troops to attack anything that's got that antigen on it. So what happens as the antigen presenting cell here is recognized by the T helper cell becomes activated. And you can see here he's all happy and he's jazzed because he's going to go tell the T cells, okay, to multiply. And it activates a cytotoxic T cell to become millions of cytotoxic T cells. So you have, lots of cloning going on here. A few memory cells and suppressor T cells are also made. But the T killer cells literally go around, and now anything that had that particular antigen is going to be killed directly by the T killer cells. They spray them with cytokines, they poke holes in them. There's a variety of different ways that they kill. So T cell mediated immunity, the cytotoxic T cells become activated, cloned, you can make thousands of them, and they go around and kill directly. Suppressor T cells grow very slowly, and only after the main amount of pathogens have been killed are there enough then to kind of tell those T killer cells, okay, good dudes, you did your job. No more murdering because there's nothing left to murder, you need to go away. So the T suppressor cells kind of keep the T killer cells from going overboard once the pathogen has been destroyed. B lymphocytes can be activated directly or be activated by the T helper cell. But essentially, when a B lymphocyte becomes activated, it clones itself into plasma cells. And plasma cells produce antibodies. Some memory cells will also be made, and we'll talk about memory cells here again in a minute, but they're going to stay around in case you get infected by the bug again later. Anyway, these plasma cells, you'll get lots and lots of them, will produce antibodies at like 2,000 per second. And the antibodies are spewed out of the plasma cells. They're free in solution. And they are going to go bind only that antigen, because antibodies are specific to only the antigen that triggered this response to begin with. Okay, so here's a picture of the plasma cells shooting out the antibodies, and notice they bind anything with that antigen. And anything bound by antibodies is like lunch for macrophages. So antibodies don't kill directly, they mark for death. And these macrophages run around and look for anything coated with an antibody and chomp them. The memory cells will stick around, and if they ever see that little bug again, they will engulf it and destroy it before you have to go through this whole response, and usually before you get sick again. So you might never notice that you've been infected with chickenpox more than one time. Again, antibodies are specific for one particular antigen. They're specific because they are proteins too, and proteins have shape, and they're only going to bind a certain shaped antigen. So antibodies and antigens bind each other based on shape recognition. Whenever you have a large antibody release, phagocytosis, inflammation, all will occur. Antibodies can bind up toxins and neutralize them. They can activate the complement, and the complement can activate them. And so you get lots of immune response when you have antibodies made, which is good because you want to wipe that pathogen out. So in summary, in the T cell mediated immune system, the T cells are activated by T helper cells to generate lots and lots of T killer cells. Cytotoxic T cells or T killer cells directly kill anything containing that antigen. In B cell mediated immunity, also called humoral immunity, the activated cells become plasma cells which produce antibodies. And antibodies bind the antigen, mark it for death, and other phagocytic cells will engulf and destroy it. You have a diagram that looks like this, and hopefully you'll have that with you when you take your test. And the left side shows this B cell mediated immunity, and on the right shows T cell mediated immunity, which kind of summarizes up what we've been talking about. The microbe is absorbed, the antigen is presented by an antigen presenting cell, and a T helper cell recognizes that and kind of kicks off everything. It initiates B cell mediated immunity by making plasma cells be made, which produce antibodies, or cytotoxic T cells, T killer cells, be made by the thousands, which kill directly. In both cases, you're going to get some memory cells generated that will float around potentially forever. And if you're ever exposed to that particular antigen again, second, third, 22nd time, these cells will become plasma cells and T cells so quickly that generally you don't have symptoms the second time you're exposed. The second part of that YouTube does the specific immune system. Again, great little YouTube. You should check that out. So now that you have a basic understanding of the specific immune response, when you are exposed to a microbe, a bug, or pathogen, whatever, your immune system goes through the specific immune response and generates the ability to fight off that particular antigen, and you end up with memory cells. If you're exposed to the antigen and you make antibodies against it, you have active immunity. Okay? If you got somebody else's antibodies, you didn't make them yourself, that's passive immunity. And that really only occurs, either you get them from mom during the time you're inside her when she's pregnant, fetal, crossing the placenta, or you can get antibodies from nursing. There's antibodies in milk that moms can pass to their babies. But most of us make our own antibodies because we're exposed to the bug itself. If you get the antigen because you're sitting next to somebody who gives you a cold, that's considered a natural way to get the antigen. If you're exposed to that, that's considered natural immunity. On the other hand, when we give people vaccines, we're giving them a little bit of the antigen. It triggers the immune response and you end up with memory cells, and the idea is we made your immune system already prepared for that disease. So when you get the measles vaccine, what they're giving you is a little bit of the antigen, not enough to make you get the measles and get sick, but enough to trigger your immune response into thinking you have it and generate memory cells against that disease. It protects you later. So we're using our own immune system when we're vaccinating. Anyway, if you get the disease, it's considered natural immunity, but if you get the antigen by medicine, in other words like an injection, that's called artificial immunity. So when I was a kid, I got chicken pox. I have natural active immunity against chicken pox. I got the chicken pox naturally, I have an immune response, and I make my own antibodies against chicken pox. When my mom nursed me, she gave me natural passive immunity by passing antibodies from her milk into me. Later on, I was vaccinated against measles, mumps, and rubella, the MMR vaccine. I have active immunity against those because I can make my own antibodies, but it's artificial because I didn't get sick, I didn't get the disease, I was given the antigen by medical intervention. So anything you're vaccinated for, you have artificial active immunity. There are some cases where we can give you antibodies by injection. The hepatitis B virus, if you're infected with that, you can get antibodies. The H-big shot, hepatitis B immunoglobulin, gives you about 30 to 60 days worth of protection. They're also going to give you the vaccine to try to make sure you have an immune response to that because hepatitis is so very deadly. The rabies disease, when you get rabies, or if you were exposed to rabies and the animal that bit you had rabies, they're going to give you human rabies immunoglobulin, which used to be peritoneal. It used to be quite painful, but it's a series of shots that will protect you against rabies, for example. Anyway, again, you have natural active immunity if you had the disease. You have artificial active immunity if you got vaccinated. If you got antibodies from mom, that's natural passive immunity. If you got antibodies by medical intervention, that's artificial passive immunity. Okay, so the last but not least, the problems with the immune system are really just twofold: an overreaction or an underreaction. The most common overreaction of the immune system is being allergic to something. You react to something that shouldn't be harmful and you make too many antibodies. And those antibodies trigger the release of histamine, which is the main chemical released during an allergic reaction. And histamine causes the difficulty in breathing, a drop in blood pressure, which if very serious or systemic can be anaphylactic shock. So if you're allergic to pollen, it might just be your respiratory system that's affected. But if you're allergic to bees and got stung, it can be a systemic reaction or anaphylaxis. Other examples of overactive immune system are autoimmune diseases. This is when your immune system kind of gets messed up and starts to attack things that are you. For example, diabetes type 1, your immune system attacks and destroys the beta cells in your pancreas, and now you have to inject insulin. Muscular dystrophy, you have a reaction against, that one can be autoimmune against the protein dystrophin. Rheumatoid arthritis, your immune system attacks synovial fluid. In Graves' disease, the autoimmune system mimics TSH, so you make too much thyroid hormone. All of these are difficult to treat because we have to suppress the immune system, and that can be dangerous. The other extreme of an immune problem is not reacting or not being able to. This is a picture of David Vetter, the true original Bubble Boy. He was born in 1971 and he had SCIDs. He couldn't do the specific immune response. He could have a fever and he could have bone inflammation and phagocytosis, but he could not do B or T cell mediated immunity. He lived until he was about 12 actually. Now bone marrow transplants can save these children. AIDS is a virus that destroys the T helper cells, and without the T helper cell you can't get B or T cell mediated immunity. And eventually the person goes from HIV positive to full-blown AIDS, and you don't die of AIDS, you die of some infectious disease that you can't fight off. Anyway, there's lots of resources for the immune system. I would remind you to try to find a website with a fairly up-to-date date on it, 2013, 14, 15, because it changes so often that even a year or two ago the immune system might be presented slightly different. If you still have your visual A&P access to Mastering A&P, there's some great topics under the Interactive Physiology section for this chapter. Great help. Holly gets the flu. I show this in micro and it's been shown in other classes, so I'm not going to show it here, but if you want to check that out, there's a YouTube link. Great explanation of the immune system, 25 minutes, well worth your time if you haven't seen it or you need a good reminder.